Welcome to the latest EASO update. I'll start with an overview of EASO. Established in 1986, EASO is a federation of professional membership associations from 36 different countries across the European region. EASO is in formal relations with the World Health Organization's Regional Office for Europe and also coordinates the EU Obesity Policy Engagement Network, or Open EU, and is a member of the EU Health Coalition and the Biomedical Alliance in Europe. EASO is the voice of the European obesity professionals, representing a community of over 20,000 scientists, healthcare professionals, including primary care practitioners and physicians, public health experts, early career researchers, students, and patients via the ECPO, the European Coalition for People Living with Obesity. EASO promotes action through collaboration in three pillars of research, education, and policy. And here's an overview of our recent education activities and plans for the future. The most visible platform for our education is the European Congress on Obesity. Normally a face-to-face congress, the ECO is now online in 2020 and 2021. It's truly an international platform for education, dissemination and networking. In 2020, we had over 3,000 online delegates from more than 75 different countries. All sessions are recorded with instant replay for over 3 months. And we also develop highlight shows for targeted audiences. We incorporate policy discussions and advocacy training into the Congress programme, and we enjoy significant international media coverage. So the ECO really is the place to go if you want to learn about the latest developments in all aspects of obesity, and if you want to network with core and key professionals in your field. We also develop more targeted education in the form of training schools. So we have our New Investigators United Winter or Autumn School. We have a Best of Eco Forum, which takes key components of the Eco programme to different regions of Europe. And we have the intensive Train the Trainer Summer School, which is an obesity masterclass for obesity management, for childhood and adolescent obesity, and for public health. And all of these are fully funded residential courses lasting for between 3 and 5 days. So these are examples of very intensive specialized training. But we're aware also that obesity touches many different medical and scientific disciplines. We're also aware that our colleagues in these areas are often too busy to join us at the ECO. So we partner with relevant sister societies and we take obesity training to them. So these are an example of some of the organizations with whom we've partnered over the last couple of years, where we take obesity masterclasses to their congresses so that we can deliver pertinent and relevant training to specialists in these areas. We also collaborate with colleagues from different parts of the world. So we have symposia and different initiatives with our friends at the Obesity Society in the US and Obesity Canada, and also World Obesity Federation. And we also support training, workshops, online and face-to-face, through our collaborating centres and our education grants for our national members. And this is an example of a training workshop that took place recently in Leipzig, Germany. And we try to host or support 4 or 5 of these different courses each year. And this slide will show you just how many practitioners we can reach with our training. So we have on the left the different types of education that we deliver, and on the right the numbers of people that we were able to reach in 2019 through our targeted obesity specific medical education. EASO also has a network of collaborating centres for obesity management, or COM. COMs are multidisciplinary specialist treatment centres that are accredited to join the EASO network. They must meet certain criteria in terms of number of new patients and patients each year, the level of expertise within the clinical and non-clinical teams, the kind of facilities and equipment that they have available, and also the levels of education and research within the institution. The COMs now comprise over 140 accredited adult centres and more than 25 centres that are specialised in the management of obesity in children and adolescents. We also attract new applications each year through our COMs Exchange and Mentoring programme, and that's allowed us to develop an international affiliate member category for COMs, for institutions, for multidisciplinary treatment centres that fall outside of the European region. And we also have a COMs education programme. We have a summit meeting each year where representatives from all COMs can come together for clinical research education, for clinical education, and for networking in their field. The COMs Exchange and Mentoring programme is currently on hold, but it's a system where people who would like to develop a new collaborating centre from scratch or improve an existing centre or clinic for COMs accreditation can visit an existing collaborating centre for 3 or 5 days of intensive training where they find out how each multidisciplinary team works and how they all fit together. So they become expert in the development of a gold standard collaborating centre so that they might be ready to establish one or apply for EASO COMS status. Now, because we have a ban on international travel at present, we can't carry out our COMS exchange and mentoring programme, so we're currently developing a virtual version of it, which will do two things. It will show people how to develop a gold standard collaborating centre or a specialist centre for obesity management, but it will also give medical education by guiding users through case studies in a step-by-step way, following the patient pathway from start to finish, looking at all the different multidisciplinary teams, how they interact. And this system will have Q&A, it will have complementary video and guideline content, and we'll also incorporate some live online discussion sessions once it's been established. We hope to launch the virtual COM experience in the next 2 to 3 months. So please stay tuned for further information. We're also very active in policy and advocacy. Indeed, we're increasingly active in policy now that we have a permanent presence in Brussels. So our policy strategy really is about embedding a narrative on obesity that reflects the scientific evidence to inform policy and practice at EU and national levels. We want to integrate obesity across all policies, leading to the development and implementation of national obesity strategies in all European countries. We aim, and indeed in some cases already are, widely recognised by the Brussels policy communities as the policy voice of the obesity community in Europe and an equal partner at the NCD's table. Will be recognised not only within the healthcare policy community, but also other sectors, mobility, education, culture, digital, etc. We'll also have structured, ongoing working collaborations with champion MEPs within the European Parliament, across political groupings and parliamentary committees. And all EASO internal stakeholders will develop and help to leverage the EU policy environment and cascade that leverage into their own national and disciplinary communities. Now, EASO works across multidisciplinary coalitions. We are the scientific secretariat for the Open EU network. We are an active member also of the EU Health Coalition and the Biomedical Alliance in Europe. And we're collaborating with partner and sister societies in many different disciplines in an effort to really embed obesity across disciplines, across dossiers, and across EU missions. And some of this policy work and advocacy work culminates in World Obesity Day Europe, which took place on 4th of March 2021. EASO's major initiative on that day was our European Obesity Policy Conference, hosted by EASO and our partners at the European Coalition for People Living with Obesity. The session was opened by MEP Pernilla Weiss and attended by policymakers from EU institutions in the European Parliament and from many other international organisations from many countries across Europe. And on the same day, we were delighted to report that the JRC of the EU has updated its definition of pre-obesity and obesity, declaring that obesity is a chronic relapsing disease. This is a major development for EASO because we were able to try to help influence the development of this definition through our ongoing communications with different EU level institutions and partners. So this now is a new definition which should be adopted by and referred to by EU Commission colleagues, and we will continue to help them with further education around obesity and policy communications. We also develop advocacy training for our own members, our National Association members, our collaborating centres, and all interested parties. EASO has a step-by-step advocacy handbook, which takes you through an advocacy campaign from start to finish. We undertake and host advocacy stakeholder events where we give updates and overviews of advocacy work and upcoming opportunities. And we deliver intensive advocating on obesity interactive training for our colleagues across Europe, often taking real life case studies and policy challenges that we follow through the step-by-step approach of our advocacy handbook. EASO is also very interested in research. We facilitate and disseminate research results, but we're also now beginning to undertake some of our own research. And the European study is looking at how the COVID-19 pandemic impacted upon the well-being of people living with obesity across Europe. And further results will be disseminated at the European Congress on Obesity and in publications in the coming months. So stay tuned for some very, very interesting updates from this. EASO is also involved in a number of EU research projects. So Protein looks at personalized nutrition using apps. Sweet is looking at the impact of artificial sweeteners on weight management. And the IMI SOPHIA project looks at patient outcomes from different levels of treatment. So I hope this has helped you understand what EASO does. Thank you very much for your attention. If you have any questions or if you have any collaboration opportunities that you would like to discuss with us, please contact the EASO Secretariat via the website. Thanks for your time.